First Lady Jill Biden has tested positive for a rebound case of COVID-19.
Yeah, a lot of people surprised by this. Her office says she's showing no symptoms. She first tested positive on August 16th while vacationing with the president in South Carolina. She isolated for 5 days and was treated with a course of Paxlovid. President Biden also had a rebound case of COVID after receiving the same treatment. With us now is CBS News medical contributor Dr. David Agus, trademark black sweater and white collared shirt. We want to ask you all these questions folks have sent in to us, but let's begin with the First Lady's rebound case. Folks want to know, do we know what's driving rebound cases after Paxlovid treatment?
Yeah, so rebound happens 3 or 4 days after finishing Paxlovid, and we think it happens in 30 to 40%. I say we think because we haven't had formal studies. There was a rush to develop Paxlovid, and in that rush, it was chosen a 5-day course of Paxlovid twice a day. In many people, we probably need a 7 or 8-day course, and then there won't be a rebound. It isn't enough duration. That being said, the rebounds are mild and they're not serious at all. So Paxlovid still is dramatic in terms of reducing hospitalizations.
Okay, so here we go with some of these questions. This person asks, I received my second booster back in March. Do you know what the next steps are? Will there be a third booster? Can I get it in September? And I'm going to add one more question. Should I get it in September?
The answer is yes, there will be a booster. Both Pfizer and Moderna will have a BA4 and BA5. That is the newest version of Omicron that's out there now in a booster that'll be available beginning of September, probably first or second week. Everybody over the age of 12 in the United States will be eligible and should get it. It will give a broader immune response. Doesn't block transmission again, which is a negative, but the positive is, again, blocks serious illness, which is seriously important in terms of the health of America.
And what about kids? Another person sends this question asking, will the Omicron vaccine expected in September be available for children as young as 5?
No, unfortunately, that the testing in children, the kind of the sad truth is that this has been tested only in mice. And while we have a lot of data for other variants and boosters, we don't have data yet in these. And so we're going to do human tests in kids before we launch it to kids. So we'll be launching 12 and older in the United States, and we're going to get more data and then make it eligible for 5 and older probably several months later.
Well, this person also asks, can you catch a different variant of Omicron soon after recovering from the virus?
Yeah, these variants of Omicron are radically different from each other, almost more different than some of the earlier Alpha, Delta, and others were from each other.
Oh, really?
So you can get BA5, and then if you're exposed to BA2, you can get it again. They are very different in terms of their shape. And so the immune system doesn't necessarily recognize them. So that's part of the reason you're seeing people, well, I just got it in June and I'm getting it again in August. These are different variants that are circulating. We have a new variant, one of the BA4s that's circulating now in the United States. And if you just have BA5, you may be susceptible to this.
So this is an interesting question. This person's asking, would you recommend low-dose aspirin to patients post-COVID infection? I know that some people just sort of take a low-dose aspirin to treat other issues, other health issues. But do you know why they would be asking about low-dose in particular?
So low-dose aspirin reduces the rate of cancer and heart disease. So it's dramatic in many respects. And the idea is that during COVID, people can have blood clots and small blood clots across the body. So a randomized trial was done in the United Kingdom of aspirin, and there was no benefit. So taking aspirin after your doctor says so for health benefits makes sense. For COVID, doesn't make sense at the present time.
Last question sent for you has to do with monkeypox. This person asking, can it be spread at the gym by folks not wiping down equipment?
I don't think so. I mean, you could shake hands with someone with monkeypox and not get it. You really have to touch an open lesion. Luckily, it is not that hardy a virus compared to COVID-19 or other viruses, but you touch a lesion, you can get spread of it. So I'm not as worried about the gym. That being said, wipe down equipment at the gym, wash your hands after touching something, et cetera. That's just normal health practices.
Yeah, that's just being a good gym person.
Yeah, really.
Dr. David Agus, thank you very much.
Thanks, Doctor.